Maryam.
Hi.
How are you?
Good. How are you?
Good. Thanks for asking. So, if it's okay, before we start, I always want to go over some tobacco use with my patients because it's very important. Um, do I have your consent to ask you some questions about
Yeah,
it?
sure.
Okay. So, I see that you're using tobacco. What type of tobacco do you use?
I just use normal cigarettes. Yeah.
Normal cigarettes. And how many a day?
About 10 a day. Yeah.
Okay. And do you have any idea how fast that nicotine affects your brain? How fast it travels?
No, I've never even thought about that.
It's around 7 seconds
Wow.
from your lungs to your brain. And how soon after you wake up do you crave that tobacco use?
Around like I don't have the urge to smoke right away, but around I would wait like an hour or so or 30 minutes after I wake up, and I would just smoke.
Sure. And do you have any of your close friends and family that are using tobacco too?
No, I live by myself right now, and my parents never used to smoke, or my close friends. But my coworker does smoke, so when I go to work, I smoke outside with them during our break before we start. Yeah, just my coworker.
Yeah, your coworker. Are you interested in stopping using tobacco at all?
No, not at all.
Yeah, no problem. And thanks for your honesty. I just, if it's okay with you, I would like to revisit this recall.
Yeah, no
And
problem.
another information. And have you ever tried to stop using tobacco?
Yeah, I tried like a couple of times, but I have a relapse because of working 8 hours a day, 40 hours a week. It's hard, especially when your coworker smoke and you take a break with them during our break time. Yeah.
It's okay. Relapses are totally normal with quitting tobacco, and every time you're trying to quit it, you're one step forward and one step closer to quitting.
Thank you.
No problem. So, if it's okay with you, I just want to share some information with you about the effect of smoking on your overall health.
Yeah, sure. I would love to.
So, it can affect your heart. You can get heart disease. It can affect your breathing. You can have asthma. You can get cancer, and it's not only lung cancer as all the people think. It's like other cancers such as blood cancer, trachea cancer, and also as women, it's important for us during pregnancy to stop smoking because nicotine can cross placenta and affect the fetus. Also, have any of your family members diagnosed with cancer?
No, not that I'm aware of, especially since like my close friends and my parents don't smoke. But thank you for sharing that. That's
Yeah,
really
no
eye-opening.
problem. So it's not only on your systemic health, it's on your oral health as well. I'm not sure how familiar you are with periodontal disease, but it's a disease of your gums, your bone, your teeth, the surrounding structure of your teeth, that tobacco can increase the chance of getting the periodontal disease. Bad breath, and also any cancer related to your oral tissues.
Yeah, definitely I can relate it to the bad breath, especially when I'm one of people that don't smoke. I can definitely feel the tension.
Yeah. And I know that they say that tobacco relaxes people, but it also these studies have shown that it increases anxiety and tension.
Yeah, I have the same thought as well, but I noticed that sometimes after going back to work after smoking, I get more anxious. Yeah, so thank you for that.
No problem. And have you thought about quitting in maybe 6 months ever?
No, I don't think so.
Yeah, no worries. Thanks for being honest. So, if you were ready to quit, what would be your reason? What would motivate you?
I think if I have one reason to quit, it would be definitely to make my parents happy, and also close friends that don't smoke, especially the smell when I'm with them as well, and also on my health. And as a woman, I would like to have kids one day, and knowing that it would affect or have a higher chance of failure, that would definitely be motivation for me.
Definitely. And what would you consider a risk if you continue smoking?
As you have mentioned, I've understood a little bit more how it's not just cancer that it causes, it's also on my oral health, like my teeth, and how I could lose my teeth. So that's definitely like a teaching lesson, and also having a heart attack as I'm like a young woman as well. If I would have like a family of my own one day, I want to live long and healthy life.
Yeah, sure. And what would be the benefit if you would quit?
As I had just said, I would have better oral health, taking care of my teeth, and also being more active, and not being so much, getting so much anxious, and also
So many benefits.
yeah,
right?
exactly. Yeah.
And what is stopping you from, since you know all the benefits and the risks, what would be the stop point for you? What's your struggle to quit?
My struggle is definitely working 8 hours a day and always hanging out with my coworkers, going on break with them, people that smoke. So that's definitely like a trigger for me. So yeah.
Awesome. I love your answers and I love how you're thinking. And I would love to revisit this in each appointment if it's okay with you.
Yeah, thank you.
No problem.